Yes, so the next one, we still work on our headaches, on our tension, and what I want to see if OA joint is not working, right? So how we check is at the lower partial of the neck, or is the top partial of the neck, and you guys already know that. To check the upper OA joints, we're gonna go add person to rotation. So we add rotation to our neck, and I just see how's our rotation happening. Now I'm gonna ask her to tuck this chin down, and well, we're looking for 20 degrees, and she kind of struggled up there. Is any pain?
No.
Okay, good. So let's say right one is okay. Let's go to the left, and I can see she struggled more. And now, yeah, don't shrug. Is there any pain?
No.
Good. So I would say the right one is a little bit problem. So what I did, rotation and tuck the chin. They will check OA joint. If one side is not locking 20 degrees down this way, that's mean the both OA joint is have a problem. Now we're gonna check with our flexion. So we flex to 45 degrees. This is the 45 degrees, and we're gonna ask Marina, look at the right and turn your head to the right. We're looking for 45 degrees. It's really struggling, right? You see this? And
Yes.
she's trying to compensate. So it's not going, and we're gonna go this way, and it's the same problem. Sometimes you can come up here, you see, don't use your hands, and ask her to turn and help her. And what I try to do, I try to help, and it's going. And now this way, it's restricted. So we might have a mobility problem on this side, and a motor control problem on this side. Because we have problem on the left side, it's compromised the right side. So I believe we should work on the left side and see how this both gonna feel. Also, what I'm doing, I check those shoulder distance. Is at the from your coracoid to distance to the table, and I see this shoulder is a little bit, yeah, especially the left one, it's higher. So definitely we're gonna work on those pecs, but not today. We're gonna work on the neck. And the first thing first, yes, I come up, I do decompression. This is how I always start with the neck. I grab my hands like this, I put them on the top of each other, whatever dominant hand is. My dominant is right, and I like to my right be on the bottom. So here we go, on the top, sorry. And this is on the top, and what I'm doing, I'm just lean with my body, you see? And I decompress the spine first, okay? Decompress, 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 you okay?
Mm-hmm.
Decompress, decompress, decompress. Now, I coming in, I lock the head, I hold the forehead, and I coming with my left arm, and I scoop all the way to the right side, to the left side. So my fingers is on the other side. And what I'm doing, I start to lift it up and scoop up, and I ask her to turn to the same side, to the right. She's turning to the right. How's it feel?
Oh, good.
And relax. She feel good. You see, I'm doing slow, no oil. Turn again. Turn, 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 turn. And I help her to turn. Good. Turn again. Turn again. And let it go. So this is the kind of pre-warm up. Turn, turn, turn. You see, I lift. My hands is straight. I'm not doing this. I'm not doing that. I'm straight. I'm using my legs. You see, I'm pushing through my legs. I'm coming up here. Because that's what most people do. They start doing, they pull this way. Yeah, you want to.
One second, I pulled my hair. Okay.
Okay, so you lift it up with your body and let it go, okay? Now, I'm sorry I gotta show you butt, but for the camera purpose, I'm gonna go this way, and you can see my fingers right there. You see my fingers?
Zoom in.
Yeah. And I do the same thing. I'm warming up before the main correction, okay? This is not the main correction. Turn. Turn to the left. Yeah, and you feel that? You feel that tension? She got a lot of tension in her neck. The next one, it's also very nice. I come up sitting position, I lift the head, and I use this part of my arm. So I'm coming right here, I lock it in, and I'm doing this. You see, I'm pulling. You feel that? So what I'm doing, I'm rotate my forearm to the top of the table, and it's kind of grab the head, and I pull. I grab the head and I pull, okay? I don't do anything like a crazy stuff, okay? This is warm up, okay? So now the guy's gonna try. Here we go, David.
How are you, David?
Yes, but actually you asked me the questions if sometimes you compress, and what I see one technique from Japanese guy, he's actually contract muscles and it's released the tension in the neck. So here we go, another answer for you.
The first one that is 20 degrees.
You do rotation as far as possible she can do,
Okay.
and now ask her
And
to
then
tuck
it's,
the chin.
tuck your chin in. It should go 20 degrees
You're not,
in.
yeah, and you're not helping her.
Oh,
You
okay.
you just kind of hold
Okay.
like this so she's not raising her.
So I'm
hand.
holding her from the bottom, right?
Yep, no, so watch out. So watch. I'm holding up here. I help her to turn, but I'm not doing anything. You see my hand is on the neck, and this one is on the top. And now she's she's doing it.
Oh,
You
okay.
see, she's kind of compensating, and yeah, it's a lot of compensation. And she feel pain, so we're definitely gonna work on those OA joints.
Then you go this
This
way, and then
This side
and
is-
go ahead.
Good.
This side's not as bad.
Yeah,
It's
you
better.
don't help her. Yeah,
Oh,
just
okay.
no, that's perfect. And now return.
Okay.
And now we check the lower portion of the back, and we check the rotation, right? We check rotation.
Mhm.
So to check rotation, we're gonna
45.
bring to the flexion, correct? 45 flexion.
Okay.
A little bit more higher. There we go, 45. And now ask you to turn.
And then turn to the right. I don't help her. I'm just holding.
Yeah, you just hold it. If,
So that looks
Again?
45. That looks
Yeah.
45.
no, you don't
No.
need to tuck right
It,
now.
it doesn't need to tuck. Just
It's good.
turn.
It's actually, okay,
to the left. She's
she-
doing good. That's 45.
Yeah.
But you have treated it.
Yeah, so we have the OA joint problem now. So OA is stuck.
How do you notice the OA is stuck?
Because she's pointing pain. She said.
Oh, and
Yeah,
here.
this side.
Oh,
Yeah.
here.
You see, every time she can move, it's a stuck. It's not movable.
So when she was
This side.
tucking, when her head was turned to the right and she tucked and
And
she
she
had
pain,
pain,
yeah.
you know that's OA.
Yeah, that's why I ask all the time the question: is that pain present? If pain present, it's failed test. It's a positive.
Fail. You
Yeah,
failed.
You failed. Your neck is failed. Yes.
You failed.
The neck is failed. It's okay. You know
Now
how
I'm
many.
going to decompress, right?
Yeah, you're doing good.
Okay.
Really good. Yeah. Yeah. Make sure the foot is moving.
I start and stop.
Good. Okay. Excellent.
Okay, and then.
You can try to scoop your arm under and do.
Oh yeah, this is the scoop. This
Scoop,
one.
yeah,
Oh.
yeah, all the way dig in there, like all the way to the other side. We're gonna do it again, no worries. We have plenty of time. We're just gonna focus on the neck. Yeah, go deeper.
Okay.
So what
And
David
I'm on the
do?
other side.
Yeah, you're on another
And
side.
then you're gonna turn,
Yeah, you're gonna hold her.
and then you're gonna turn to the right.
Yes.
No,
But you should pull this side.
And you should.
Yeah, you
yes.
pull
Okay.
up, straight up. So you're pulling straight
So
up.
how do you? Okay, she's.
With your legs.
Okay.
You know, I'm not
Well,
used
no.
to having oil. I usually have a little oil.
You
Hold.
can use oil for this.
Yeah, watch. You
can?
You just
No, because see,
try it. So
it doesn't use oil.
try this hook like this, hook like that, and you just pull.
No, you
pull,
don't need
but
oil.
you pull this way. So you pull,
Mm.
you kind of stand up.
Oh, right,
It's
that's
like
true.
it's like those
Oh, I
guys pick
see.
up the like a barbell from the
Just
floor
like
and
this.
lift it up. Yeah, your
Like
back is
this.
straight.
And I
Oh, and load your hips, and now boom, stand up.
stronger.
Okay, stronger. Oh.
Oh,
Yeah,
okay.
she wants to
Oh.
break her neck. Okay.
No,
That's-
because I feel you
That's
drink,
why
you
she
drink something different.
that's why
it's not the
that's
same.
why she asked you about insurance today. So she wants someone break. She wants someone
Sure,
break.
no, because you don't do the
Yeah.
same thing. That's why.
She wants to you break her neck and you know.